To kick off this community conversation, we're going to hear from Jimmy Castillo, a rare disease community member living with generalized pustular psoriasis, or GPP. GPP is a rare type of psoriasis that appears as red patches covered by tiny pustules all over the body. It can appear suddenly with severe, more widespread symptoms like fever or malaise, or it can occur more gradually with less severe symptoms that are mostly limited to the skin. Today, we'll hear Jimmy's experience living with GPP. If you'd like to read more about this disease, we will share the links to NORD's rare disease reports on GPP in the chat. Jimmy, thank you so much for being here with us and sharing your time and your story with us this afternoon. Can you please tell us a little bit more about yourself, where you're from, and how long you've been living with GPP?
Yes, hi Leah. Good afternoon, everyone. My name is Jamie and I live in Southern California. Um, I've been living with GPP for the past 6 years since I was officially diagnosed through my dermatologist. Living with GPP, it has been quite a stressful journey, um, but I have been able to learn a little bit about it and learn how to live with it. But I was diagnosed about 6 years ago.
Okay. So tell me a little bit about your symptoms.
My symptoms are, to begin with, I also suffer from plaque psoriasis. So my symptoms are a little bit different from plaque psoriasis. Having GPP or generalized pustular psoriasis, it's you get like they kind of look like blisters with a little white tip on it that pus comes out of it when when they are ready to, well, actually when they how would I explain this to be more specific. Um, they look different from plaque psoriasis to begin with. So I noticed there was something different about the condition when I noticed the GPP. So I brought it up to my dermatologist and I started discussing my symptoms because they were actually painful and I was feeling fatigue and I was feeling kind of more depressed than usual because depressed comes with plaque psoriasis, but having GPP is kind of like the same symptoms, but also different at the same time. So I'm not sure if I'm making myself clear at the moment, but the symptoms to begin with are kind of like blisters with white tips on them, the most specific term.
Okay, so what was the journey to diagnosis like for you? How did you figure out what was going on?
Well, like I noticed there was something wrong with my G when I noticed the GPP, my pustular psoriasis, because they look different from plaque psoriasis. So and then they felt different, they looked different. So I brought it up to my dermatologist and she told me that it was just psoriasis, part of generalized psoriasis. So I wasn't confirmed with the diagnosis. So I started doing a little bit of research and to my surprise there was no information, there was no research online. So I know it was something different because it looked different and it felt differently. So I made another appointment and I asked her if she can make sure what it was. So then she then proceeded with a test, like a skin graphic test. And that's when she told me that it was GPP. But this took like months after and almost like 2 appointments after. So.
So you mentioned depression a minute ago. I wanted to know, how does GPP impact your emotional and psychological well-being?
Wow, it's been a journey. My GPP usually comes out on sites that are visibly seen, and through that comes like stares from people. People look at you and they think you're different. First of all, they think it's contagious. They think it's a contagious rare disease. So it's psychological because you're not able to live your life to your fullest. Me, I love to travel. I love to go out. I'm an outgoing person. So it kind of puts a hold on me to be who I am. So it's doesn't allow me to be myself at the fullest. So that brings me down. That brings the and you have no idea how it feels to be stared at, to be thought of, to be thinking that it's contagious. So that always affects me. So of course I see counseling and then I see community forums. I try to learn about my disease. I try to update myself on how to overcome this, but it has put a damp on my life, quite a quite big damp on my life. So psychologically speaking.
Okay, so what do you think is important for success in the provider-patient relationship when you're living with a rare disease?
Communication, definitely, by all means, communication. You need to communicate what you're going through, what you're feeling, not only the symptoms or what you have, but also what you're feeling through. Because if you don't communicate that part of yourself to your provider, they won't be able to understand how you feel. They would just diagnose you like, oh, it's just plaque psoriasis. It's just this. No, you need to be more specific on what you're feeling and what you're going through, so they can fully understand you as a patient, because having GPP and having plaque psoriasis, it's under the big umbrella, but it's different. It's also separate. It's completely separate. So you need to be able to communicate that with your doctor, so they won't be just, and like they normally think it's just generalized and they just give you a prescription and that's it. They need to be able to separate those two and treat them differently. So that for me, communication is key. It has helped me so much, and ever since that first conversation that I had with her, that it was something different, it changed everything completely.
So have you connected with other patients living with GPP?
Yes, just recently I did. I attended an event which was great, and I met other GPP uh sufferers or people that suffer from it, and I was able to connect with them, and it brought so much joy to me, because first of all, you know that you're not alone when you meet other people that suffer from the same condition that you're suffering with. So you communicate with them, and then you interchange stories, you talk, and it was like endlessly talk. Like, you you share stories, you share what you do to get better. And what I take away from that is that you're not alone. You're not suffering alone. There's somebody out there going through the same situation that you're going through, and it just makes you feel so good. Um, um, that there's people out there that are suffering with you, per se.
And people who understand you.
Yeah, exactly. Who understand me, Leah. Correct.
So leading up to Rare Disease Day, what do you hope the world sees or hears from you today?
To fully understand what a rare disease like GPP is, um, to learn and take away from my story that there's different things to know about people who suffer from rare diseases. It's not only having a rare disease, it's also what they're going through, what they're thinking, how does it affect their lives and my life. I want people to know that rare diseases are out there, and we shouldn't be scared of them. We should learn from them. We should acknowledge them, and we should learn, once again, learn from it, but kind of look at a way that it won't affect them anymore of what they're already going through. So hopefully by this sharing my story, I would share more and be able to understand how everything works. Because even though to this day, living with a rare disease is difficult for me to understand it. So hopefully they will understand it a little bit better by me sharing my story.
I can tell you I've learned a lot from you today, and I'm sure people on the phone have too. And I hope that you know you are really making a very meaningful impact, being so brave and sharing your story with all of us. So thank you so much. It has really been an honor to talk to you.
Thank you, Leah.
I'm going to hand it back over to Darby. Thank you.
Thanks so much, Jimmy and Leah. I'm just going to share my screen. Alrighty. Janine, do you see my screen?
Yep, I do.
Perfect.
Yes.
Lovely. Okie doke. Whoops. Okay. So thank you, Jimmy, so much for sharing your experience living with GPP and for your vulnerability. I just again have the interpretation instructions on this slide. I'm going to move to the next slide. So hopefully everybody and needs these, sees them. In the meantime, I just wanted to mention that our interpretation services are being provided by, Equal Access Language Services, and I'm really grateful to them for their support. So I'm going to go to the next slide so we can get going with the rest of the presentation. Okie doke. So Jimmy, again, thank you so much for sharing your story, your experience navigating rare disease. As it's a perfect example of why our entire community needs to be engaged in raising awareness and providing education on Rare Disease Day to whatever extent people are able to engage. And beyond Rare Disease Day, thinking about opportunities to raise awareness and provide education year-long. It's really a year-long effort. All of our community members live with their rare disease 365 days a year. So Rare Disease Day is a great opportunity for awareness, and it's a great catalyst for the rest of the calendar year. In addition to Jimmy's story being a great example as to why we need to provide education and raise awareness, it's also a really great example for why we need data on the rare disease experience to advocate for better healthcare and better policies that improve life for everybody in our community. So with that being said, the remainder of this presentation will be delivered by myself and by my colleague, Janine Lewis, who's NORD's Director of Research Operations. And we're going to be sharing some information about a research project that NORD launched to collect data on the rare disease experience for that very reason, to use it to fuel our advocacy efforts and to help key decision makers understand the true impact that rare disease has on daily life. And this research project is called the Living Rare Study. So for many of you on this call, the information on this slide will probably feel very familiar to you. Living with a rare disease or caring for someone with a rare disease comes with significant challenges that have serious impacts on daily life. And we know that our healthcare system really wasn't designed for an individual with unique or complex medical needs. It wasn't designed for the 30 million people in the United States living with a rare disease. So that situation has created a really kind of challenging environment for our community to navigate. And in the absence of having data on what it's like to live with a rare disease, we continue experiencing extensive diagnostic journeys, difficulties in accessing adequate care, lack of treatments, slow scientific discovery, and really high costs for medical care and high costs for many other services that rare disease patients and families rely on. So to address this gap in data, NORD set out to capture the real-world impact of rare disease in hopes that that information will help us drive advocacy efforts aimed at improving healthcare policies, increasing access to care, and obtaining funding for much needed resources for our community. We've seen other groups like cancer groups and diabetes organizations undertake similar efforts that have proven vital to advancing policy, creating targeted programming, and improving quality of life for their patient populations. So we are on a mission to capture similar data for our community on the lived experiences that they have, and we're doing that through the Living Rare Study. This study is the first ever large-scale study in the US to track the evolving experiences of thousands of individuals and caregivers impacted by rare disease. And the study was built with input from patients and caregivers on an advisory committee, in addition to healthcare professionals and patient advocacy organization leaders. So we had a really wonderful, diverse group of individuals that were providing such valuable insight in the creation of the study, in the creation of the questions, the creation or the kind of decisions around topics that we needed to assess. And I think that in engaging stakeholders across our community from the beginning and the creation of this project, we really created a survey that that analyzes all aspects of living with a rare disease. And that was really important to us. We wanted to capture the emotional burden, the physical burden, the psychosocial burden, the financial burden, so that way we really glean a holistic understanding of all the ways that rare disease impacts an individual and somebody's family, their caretaker. So all that is to say, the study aims to examine the experience of living with a rare disease or taking care of somebody with a rare disease. And as the longest standing patient advocacy organization for all rare diseases, NORD is so excited to use this data to shape our programming. This data will help ensure that our programming is really customized to meet the needs of our community and that we're identifying gaps in a timely manner. We'll use this data to inform national and local policy decisions and priorities. And we'll use this data to support increased access to resources that improve quality of life. We'll use this data to help elevate research on the non-clinical aspects of rare diseases. When we're thinking about non-clinical impacts, we're talking about impact on psychosocial health, impact on a family's finances, things that impact all of us really significantly. And in some cases, it could be the most significant implication of your rare disease, but because it's not clinical, maybe it hasn't really been studied or researched, and there isn't a whole lot of data on it that you can use to advocate to your lawmakers about. So that's a big part of the Living Rare study, is capturing the emotional and kind of mental implications of living with a rare disease. And lastly, we'll use data to educate and partner with public health officials and other organizations. It's really important for us to make sure that our community has a really strong voice. There's 30 million Americans living with a rare disease, and individually the experience is quite isolating. But when we talk about the collective impact that we can have as 30 million strong, it could be pretty significant. So we're excited to use this data to partner with organizations outside of the rare disease space and inside of the rare disease space to educate the general public and stakeholders outside of the community on what it means to live with a rare disease. So with all of that said, I'm really happy to turn the mic over to my colleague, Janine Lewis. Again, she's our Director of Research Operations here at NORD, and she is going to provide an overview of the study design and what participants can expect when they are taking the survey.
All right, thank you so much, Darby. It's so great to be here and to describe this study. We're very excited about it. And I just want to reiterate that this is an IRB approved study and that was designed, and the questions included or developed in partnership with patients and caregivers. And the overall objectives are to establish a baseline understanding of the experience of the rare disease community as a whole. It's disease agnostic. And to assess the changes in experience over time. So there are three broad topics that the questions are trying to understand. And the first is access. And kind of types of questions you might see in that area are, what are the societal health insurance or system imposed barriers to accessing diagnostic testing, care, and treatment? And how do these barriers differ across states, across rare diseases, insurance types, and demographic groups? What is the impact of the barriers on how long it takes to get a diagnosis and the ability to receive high quality care and approved treatments? And then the next big topic is the burden. What are the examples, or what are the total healthcare costs to support an individual living with a rare disease? And how much variability is observed across states, insurance types, diseases, and demographic groups? And what are the indirect costs associated with a rare disease? For example, food and utilities and childcare costs and education. And finally, a big broad topic is the impact. What are the impacts of the direct and indirect costs for medical care on educational attainment, on employment, on the ability to obtain basic needs, the ability to maintain care regimens, on the overall financial stability and on quality of life for the individuals with rare disease and their families. And also understanding coping strategies for both patients and caregivers. So in addition to surveys that ask questions about these general topics, there is another section just for caregivers to provide information about their own experience caring for someone with a rare disease. So what to expect? This slide answers commonly asked questions about the survey. Number one, who can take the survey? Anyone living in the US who has a rare disease or suspects they have a rare disease and their caregiver is eligible to participate. On the previous slide, we talked about broad question topics, but overall, the questions included will be related to your experience navigating life with a rare disease, from pre-diagnosis, new diagnosis, 10 years beyond, and in between. The survey takes about an hour to complete, and you can save your progress and return later if you need to. We encourage everyone to try to complete the survey within 7 days. And the study is designed to capture the rare disease experience over time, so we can better understand how experiences evolve and what impacts our policies and changing landscapes having on the rare disease community. So every year, participants will be asked to come back to the survey and to update their answers as their circumstances change. All of the information provided will remain confidential and fully protected. If you change your mind at any time, you can withdraw from the study and request that your data be removed. Qualified NORD staff, study staff, will have access to the data as needed to manage the study and to provide platform support and maintenance. And in collaboration with the Study Advisory Board, a committee that will include scientists, doctors, and patients, data may be provided to approved researchers with Institutional Review Board or IRB approved projects. And no information that could identify you will be disclosed when the results of research conducted with data from the study are published or reported. So these are some of the frequently asked questions, but there are lots more, and you can find answers to more frequently asked questions on the Living Rare Study website at livingrarestudy.org/FAQs. And we also encourage you to contact us if you have a question that hasn't been answered yet. So with that, I think I'll turn it back to Darby, who's going to talk more about how we're getting the word out about this survey.
Thanks so much, Janine. And to contact us, we have a study email address. Janine, if you're able to put that in the chat, that would be fantastic.
Yes, will do.
Thank you. Alrighty, so I'm going to go on to the next slide. We have a promotional toolkit available on the study website. It's called livingrarestudy.org. That website, there is an English version and there's also a Spanish version of that website. If you're interested in utilizing some of our social media assets or some email templates that we developed to share the study, you're welcome to do so. We would absolutely love if you'd like to share information on the study with your networks. The more individuals that participate, the stronger our collective voice will be. So we greatly appreciate any help in getting the word out. And if you are in the community on Rare Disease Day, attending events, especially events hosted by our NORD's Rare Action Network, you'll likely see our flyers. So keep an eye out for our flyers at these events. We're super excited to get these marketing assets into the community and really starting to spread the word and get people aware of this opportunity to engage. And if you are a rare disease patient, caregiver, or an individual suspected of having a rare disease but are currently undiagnosed, you can consider joining us in making a difference by sharing your lived experiences. You can go to livingrarestudy.org to learn more about the study and to participate. And if you're looking for ways to get engaged in advocacy and celebrate Rare Disease Day, this is a really fantastic opportunity to ensure that your voice is heard. So we have a QR code to the Living Rare Study website on this slide. The study URL is also on this slide. And we'll be sending out a recap email with links to more information on the study as well to everybody that's attended today and to everybody that registered. So with that, I'm going to stop sharing my screen, and we have some questions that I'm going to get to. And just a reminder, if anybody has questions, I've been looking in the chat, everybody's been sharing a little bit about themselves. I don't think I've seen any questions, but just a reminder, if you have a question, please submit it through the Q&A tool. You can find that in the bottom of your Zoom toolbar, or if it's not there, you can click more, the circle with the 3 dots, and it should be one of the drop-down options. So the first few questions that I see are related to the Living Rare study. One is, am I still a good candidate to participate in the study if I have both multiple diagnosed rare diseases as well as no diagnosed overarching condition? So I think that this person is saying maybe they have some diagnosed rare diseases, and then maybe they have some symptoms affiliated with another disease that may not be diagnosed. And this person, you're welcome to send a chat if I'm misinterpreting this question. But I think that's the question. So Janine, would you like to answer that?
Yes, please participate. If you have more than one disease, there's an opportunity for you to be able to pick the rare diseases that you have been diagnosed with. There's also a field in the study where you can enter information about an undiagnosed, if you're undiagnosed, you can let us know.
Thank you. And then I see another question. How many people do you expect / hope will participate in this study? So that's the one question. And then the second question this person asked, will they be just from the US or from around the world? I am happy to answer this, or Janine, would you like to answer this one?
We are hoping to, there will be thousands of people participate in this study. I think that was the question that you were asking. And the study is open for participants who are living in the US. And so those are that's the eligibility criteria for the survey.
Yes, and if anybody is joining us internationally, there is an organization called NORD that has a research project called the Rare Barometer. So though ours is inclusion criteria for our study is people living in the United States, the Rare Barometer does exist, and it's an opportunity for you to participate if you live outside of the United States. We have another question. When will results / insights from the study be available? Janine, would you like to answer this one?
We're anticipating that in 2025, this will be the year of gathering data. And in 2026, we'll have enough data to be able to start developing reports on the data. If we're, really, if we get, more data sooner than that, we will disseminate that. As soon as we have enough data, we feel like that the report is going to have a meaningful ability to analyze that data and come to some conclusions.
And I see somebody asked, any clinical trials ? In the chat. So I'm just dropping the link to clinicaltrials.gov in the chat. It's a really great way to find clinical trials that you may be eligible to participate in. This study is focused on capturing patient experience data. And it's all participation is completely virtual. It's a survey that you'll complete and you'll come back year over year to update your responses. So this is not, this would not be, if you're looking for clinical trial opportunities, that is not the type of kind of research project that the Living Rare study is. I see a question from Brad in the chat. How would this survey work with the I Am Rare surveys also hosted by NORD that many patient advocacy groups have? We worry a bit about patient burnout with all these surveys. I think this question is probably best fit for Janice. Her team oversees our I Am Rare 2.0 platform. Sorry, Janine.
Would you repeat that question for me?
Sure. It's in the chat and it says, how would this survey work with the I Am Rare surveys also hosted by NORD that many patient advocacy groups have?
Right. Yes. Great question. What we really encourage is for any participant who comes in who where there is a registry in the I Am Rare platform, they will find that when people indicate that they have a rare disease, we have created a link to the I Am Rare, to the other studies in the platform so that people can search for if they have a specific disease that may have a registry already in the platform. And so they can complete those surveys and that registry information and come back to the Living Rare study. We really are, this particular study is for all rare diseases, and that we know that the vast majority, there are 10,000 rare diseases, and only 2,000 of those rare diseases have an organization that supports them. So the vast majority of people living with a rare disease don't have an organization or don't have a patient registry. So we're hoping this will be an opportunity for everyone to be able to share their story.
Thanks, Janine. We have a few questions in the chat for Jimmy. One is more of a comment, and then one is a question. So, Jimmy, the comment for you is from one of our participants tuning into the Spanish broadcast, and they asked if you'd be willing to share your contact information. So I just wanted to mention that so the person knows that we received it. And Jimmy, you and I, we have everybody's email address so we can connect afterwards if that's something you'd like to do. And then the question for you is, can you speak to some support systems that have been the most helpful in your journey?
Yes. Can they hear me?
Yes, we can hear you.
Okay, great. Yes. A great support system that I have in place that I normally go to, and it's my go-to support system. It's the NPF, the National Psoriasis Foundation. They have great forums and great chats, and I also get involved with certain events like conferences, 5K runs, or walks in my case, where you get to meet other peers and talk about your experiences, and it's just great to go. The National Psoriasis Foundation has helped me so much, or for the last, I want to say 8 years, and I've been greatly involved with them. So that's one great support system that I do recommend.
Fantastic. So yeah, we were just talking about, as Jeannie was just talking about how there's about 2,000 diseases that do have groups that represent them. So if you're not connected to your disease-specific group, that's a really great way to get involved and meet other patients and find some connection and find other people that understand kind of what you're going through and find opportunities for disease-specific research. Thank you, Jimmy.
No problem.
And Jimmy, I have one more question for you. Somebody asked, you talked a little bit about the emotional aspect of living with a rare disease. Do you have any coping strategies that you can share with the group?
Coping strategies. I try to take it day by day. When you live with a rare disease and it affects you psychologically, the way it has affected me, being depressed, being kind of in a mood downer, not most of the time, but at least a little bit of the time every day. Um, I tend to just relax, listen to relaxing music and just put myself away from everything that's bothering me. That's just something that I personally do in order to cope with something of this nature because I know there's medications, I know there's so many outlets um, via medical ways that I can go through, but I don't want to get involved in more and more and more medications. So I tend to kind of like put myself stress free from everything that's going around me. And that's one way of coping with it. And of course, I also take medication for certain things. So I'm just trying to avoid myself going on more and more and more.
Thank you for sharing that, Jimmy. So for anybody that has any questions that were not answered, we will follow up with you individually. If you think of questions for Jimmy or about the Living Rare study in the future, you're welcome to reach out to NORD anytime. Any questions specific to Living Rare study can go to our study-specific email address that Janine put in the chat. That's lrstudy@rarediseases.org. If you have just general questions, questions that you'd like us to get over to Jimmy, or questions about getting involved with NORD, about Rare Disease Day, about grassroots advocacy, you're welcome to reach out to action@rarediseases.org. Sorry, I'm going to pause. I'm going to go back to one more question that we just got. Where can I find information about groups for patients living with rare disease? I'm just arriving to the USA. We have an amazing information services team here at NORD that can get you connected to disease-specific organizations that may exist for your disease, and also support groups that may exist. So we will follow up with you. We'll have your email because you registered for this event, and we'll get you connected to our information services team here at NORD. Okay, so back to what I was saying, please feel free to reach out via email anytime. We're very accessible. And we'd love to hear if anybody has any plans for Rare Disease Day. You're planning an event, you're lighting up a structure in your town in celebration of Rare Disease Day. We'd love to hear from you. So please reach out to Action at Rare Diseases anytime. And lastly, thank you so much to Jimmy for giving us your time this afternoon and sharing your story with us. I hope everybody has a lovely Tuesday. I think it's Tuesday afternoon, and we look forward to seeing you on the next virtual event. Thanks, everyone. Thank you.
Thank you all.
Thanks to everybody that's saying nice things in the chat. I hope you have a nice afternoon. Bye.